next meeting is for deciding whether you need to stay on your CT or whether you can go back on section 3.
Right.
Do you think you need to be in hospital?
Not now, no, because I don't consider it a hospital. I don't think you get better here. I think you get worse. I think I could find evidence all through the patient's letters. You know we don't get on. You know I don't think you're a very good psychiatrist. And you always use Clopixel. I think I'm allergic to stuff. I hate it.
And it seems that you are not accepting your depot in the community for some months.
Now this isn't true. I haven't had it for some months. I was very willing to accept it. I simply forgot that it was due. In that time, you're not missing that anyway. People put the codes in the phone.
Sorry, I was not looking at your phone.
Up there, you get 1,000 quid. This is despite meeting the delegated community, this is true. Community, the dates might not be, but they're practically spot on. I'm not certain the actual dates because the calendar is difficult. Despite meeting the delegated community nurse, Mike, and being polite, he didn't answer his phone last year when I was evicted for an untidy room, thus losing my property. He didn't answer all through me living in the tent without my glasses, etc., for breakfast and injections when requested. He has since omitted to inject me for nearly 3 months. I somehow didn't notice either. However, over that time we met for coffee at Number 1 Coffee on July 12, 2024, and we met in Brandon Park with one of his colleagues on the 12th of August, according to my records. He failed to inject me with aripiprazole both months. He didn't apologise, just turned up at the police station after yet another arrest, this time for accidentally hitting a 50-year-old on a fat ass with a vape. She howled in pain. I went aiming at her, but that's what happened. That's where it landed. I punched Mike through the cell hatch. Crunch. Ha ha ha. Revenge is sweet. So you understand?
Why did you punch him?
It's because he is responsible for a great deal of suffering. He purposely didn't inject me for 3 months and then lied that he did, and that's wrong.
Do you think because whatever's happened about the injection, do you think your mental health has got worse because of it?
I've got very bad mental health. I need help with mental health, but this isn't the place. Clopixel's not the drug. I was tested on Clopixel in 1987. It isn't the drug then, and it isn't the drug for me now. So, olanzapine's the best drug I've had.
When were you on that?
For 20 years. I was on it for 12 years or 20 years. 12 or 20 years, I was like, sorry. Do you mind, Mr.
2016 onwards. 2016 onwards.
Can you speak up a little bit, Dr. Singh?
2016 onwards.
2016 onward?
Yeah.
What about it?
You've been on olanzapine from time to time.
Where have you been? Where are you living?
I think that's correct. I was on it before that. I was on it before 2016. Possibly. Well, what's the point of coming up with a fake fact? That simply wasn't true.
Well,
why would you, is that to test my memory? Because it's going.
We certainly know that you have been on olanzapine from time to time.
Let me work it out. 75, 85, 95. That's probably 2000. 2, 3, yeah. What did you say? 2016? See, there's 10 years difference. Right. Well, I'm right and you're wrong. I'm not grinning, you are grinning. Who are you smiling at?
What do you think needs to happen now, Robert? What would you do? Where would you go? Do you want to be here?
I want to be released. I want to go back to where I live. I've got a house viewing coming up this week. I have to phone it and say, yes, I want to view it. I've already been for the interview and passed, nearly got the flat. Now this week I have to go back to that, and she's run me and view the flat so that I can get into the flat.
So where have you been staying at up till now?
Long Hills.
Have you still got a room at Long Hills?
Yes.
Right.
I won't have long. If you want to, if you want to play with me here, if you want to inject me and stuff, I won't have
Well, I
it.
expect the staff until they can hold, they can sort that out. But you think your mental health's got worse because you haven't had the injection?
Mate, I've been living with junkies, heroin addicts on five sides of my room, in the corridor outside, downstairs with a sliding door, to the right the kitchen, and the other way the corridor or something instead, and outside, and I can hear them congregating outside. It's quite exhausting, yeah. It's quite exhausting. And my mental health ain't great because the fucking nurse who said Mike, who said he was a nurse, chose not to inject me for 2 months, and now I was nearly 3 months without it. And he denies it and lies about it. I haven't got a good memory. I've got dementia. I've got lots of problems. I don't like talking about them because I don't consider these doctors. I have no respect for this. You know that. I mean, it's just atrocious. I'm hard to assess now because of what you've injected me with overnight.
So if we suggested that you should stay in hospital just to make an assessment happen and also see whether the treatment is working or not, would you be able to stay in hospital?
I can't get out. It's a lot to the ward. How can I get out?
No, I mean, would you voluntarily stay in hospital if you are left, like, not detained on Section 3 and kept on CTO?
It depends who asks me.
I'm just trying to understand.
Depends what ward. What are you on about? Would you jump off the spaceship and see if the moon was cheese? If what relevant question.
The other thing we wanted to understand was why did you assault so many people before you were recalled?
I didn't.
It seems that there was an assault or
There's a lot of lies, mate.
items thrown on an old lady.
An old lady? I
There
didn't.
was some items thrown towards an old lady.
No, I chucked a vape up in the air and the old lady hit her on her bum. And 2 policemen I was trying to get out of the city, two policemen, as I still will be, eventually, one day, I will leave this place. They had those 3 dots instead of numbers on their lapels, and they arrested me. So I'm here. You say you're lying. You say you're plural. I never saw people plural. I threw a vape in the air from the Bay Horse, having got so angry I couldn't get a cab, couldn't get on a bus, they wouldn't let me on the bus, because I was in an angry state.
Why were you in an angry state?
Why? Because I can remember. It was good reason for it though, because everyone was blanking me and I couldn't get out of the city. I got paranoid. Why can't? If you was homeless in a tent, right, and ice in it, and in a city without your glasses, and you phoned this nurse guy who's been harassing you for years, and he won't even answer his phone, that's annoying. Because I can't actually remember. What was the question here? My memory's going, man. I've got dementia, which you've brought forward, haven't you, Dr Singh?
Would you stay in hospital just to get an assessment?
I'm staying in hospital, so why you keep asking me that? I don't want to. I want to go and clean my flat. I want to get the medication I need. There's lots of things I want.
Well, you don't want Clopixol?
Did I just say that?
Just checking, just double checking, just to make it clear, that's all.
But mate, the thing is, he says it so many fucking times, Monday I might slip. Dr Singh, you're a president in the room. You know I don't want to take the pixel. It's the one thing you know. So you should know that. Do you or do you not know that I don't? Tell me, Dr Singh, do you know that I don't like the pixel?
Well, you have
Are you aware?
Mentioned, but you have
How often have I mentioned it?
When you have been well, you have said that you liked it.
I've never said I liked it. You're a liar. You're a liar.
There was a time when...
there was never a time I've liked Clopixol. I've never suggested I take Clopixol.
There was a time...
What's it? Largactil, maybe, that's the weird one. I sometimes say I like that, but I've never once said I like Clopixol. You're lying to me to get a rise. Why?
Well, there was
You
a
should
time...
know me better than that. There was never a time.
There was a time when you...
What, in 2015? I can show you the evidence. If we scroll back to 2015, we'll find there's a big thing about how much I hate the pixel. And every time I mention psychiatry on here, I mentioned that I hate Capitol. So how did that information not get to you? Because I've used it every time I told you.
Yeah, it does get to us. We do know.
So why did you ask me if I liked it if you know I don't?
Well, when you are not well, you don't like it, definitely.
No, when I'm not well, I definitely don't like it. When I am well, I definitely don't like it. I can't sit still on the shit. I've had to take a load of benzos now. I think I've taken promethazine or something this morning just because I can't stop moving when I'm on it.
So I think the plan is for us to keep you in hospital for some time on Section 3. Just to make an assessment and make sure that your acute deterioration is controlled.
I am just total look of surprise. Go on, and then what?
And then we can discuss any changes to your treatment options in terms of Clopixol being continued or not afterwards.
Yeah, well, you've done it before. You've injected me for 6 months in against my will in the community with Clopixol. It's the worst 6 months of my life, I think. Do you think you're evil? Do you think you're evil?
We have to choose what.
Can I take a photo?
We have to choose what works for us.
Thank you. You got to find what works for you, yeah? You got to find what works for you.
Yeah.
You said you wanted me to. Last time I was in here, last admission, you said, Oliver, you're capable of being a very good counsellor, listening and stuff. What about what I want, Dr Singh? I've heard that from other nurses. What about what I want? I'm an engineer. I'm a talented artist. I don't want to be a counsellor and counsel people.
What sort of art are you doing?
Well, and usually I have an artistic project on the go all the time, but recently I've been homeless, haven't I, for 2 years because of home choice. I do my you can find me on here, Oliver__Snow. I make little films for YouTube and Instagram and Facebook and Twitter. I kind of that's what I do.
Okay, so that's the plan at the moment.
What's the plan?
Plan is that you stay in hospital under Section 3.
Yeah.
And then we will make an assessment how your current medication is working, and once you're settled, and if we can change them to the ones that you want, then we will do that.
Unbelievable.
You can appeal. Or give me this stuff.
Give me this stuff to appeal, eh?
The nurse is on. I haven't got it here, but now I have it.
What's your job?
Social worker.
I'm definitely appealing against the Clopixol. Find me bundles again.
Thank you very much for talking to us.
Bye-bye.